on behalf of the organizing committee, thank you for your making the presence felt here. We are very glad to see all of your faces here. Unfortunately, most of the committees and the personal invitation that we have given, due to some personal reasons, and like our chief guest, our deputy commissioner was supposed to be here, but because of some engagement, we couldn't able to make it. We have a guest of honor with us also, and our resource persons already here. Still coming people are, so all of you are welcome. So we are here to observe the World Hospice and Palliative Care Day, Nagaland chapter, jointly collaborated by Syrian Palliative Care, Eden Medical Center, St. Joseph Pain and Palliative Care Home, and Christian Institute of Health, Science and Research. We are here to celebrate and to observe the World Hospice and the Palliative Care Day. So thank you all once again for here. I believe that our gathering here and what we are going to learn together, it will enlighten our mind.
It is my great honor to welcome you all on this observance of World Hospice and Palliative Care Day 2025. I want to thank the Almighty God for blessing us this wonderful day, bringing us together here, giving us an opportunity to gather together for a purpose, to honor the work of palliative care. This program is a joint collaborative of Syrian Palliative Care, Eden Medical Center, St. Joseph's Pain and Palliative Care Home, and Christian Institute of Health, Science and Research. And we are deeply grateful for the spirit of collaboration, showcasing a true teamwork of palliative care. Today is not just another day, it is a day that holds a deep meaning for all of us who believe that care goes beyond cure. As we observe World Hospice Day, the theme for this year reads, Achieving the Promise, Universal Access to Palliative Care. So far, our leaders and speakers present here today, and those who were not able to come in our midst, have made this platform more meaningful. Our leaders have been instrumental in supporting palliative care in our region, and we are deeply grateful to them. I extend my heartfelt gratitude for their support and their instrument in our progress thus far. We look forward in the future that this initiative will continue to grow with their guidance and support. We are honored to have our guest of honor, Sir Geoffrey Yedden, Editor-in-Chief and Proprietor, Nagaland Post Daily, with us here. I request Sir to kindly stand on his feet and receive a token of appreciation from us. As we begin this program, may it inspire all of us to continue strengthening palliative care service in Nagaland and even beyond, ensuring that each person receives care and support that they deserve. Once again, on behalf of the organizers, I welcome each one of you here. Thank you for being here, and your presence have been highly valued. May this observance renew our commitment to serve with empathy, love, and hope. Thank you, and may God bless us all.
Palliative care is taken as caring for dying people. Okay, those people who are dying, we palliative care. Not wrong, I would say, but it's not fully correct. And then they say palliative care is started when all other treatments are stopped. Okay, that's a myth. The reality is palliative care is for everyone with a serious illness, regardless of prognosis. It is focused to improve quality of life. Starting palliative care for a dying person is a care which is started too late. So, okay, we provide palliative care for people who are dying. End of life care or terminal care is a very important aspect of palliative care, but that's not all about palliative care. If we are going to start a care for a person whom we know is dying, is starting a care very late. We are too late to start that care. So I would say palliative care is started for a person who is not dying but is diagnosed with a serious illness. So palliative care is started, or I would say holistic care is started for a person who is being diagnosed with a serious illness. Now serious illnesses are different. So next slide please. So a general definition or a simplified definition for palliative care would be a type of care that focuses on improving the quality of life for individuals with serious or life-limiting illness such as cancer, heart disease, neurological disorders, etc. So there are two things written here. One is improving quality of life. That's the main goal of palliative care. And this improvement in quality of life is done for those people who are facing serious illnesses, or the other word which is used for serious illnesses are life-limiting illness. So I hope I'm a bit clear about palliative care. So those who are from non-medical background, they should take palliative care as an approach which provides a medical care to improve quality of life of a person who is facing serious illness, and not only the patient but also the family members, because it is not only the patient who is facing the problems, but the entire family is facing the problem. And we do it by providing holistic care. So our approach for such patients who are facing life-threatening illnesses, so palliative care approach would be improving quality of life. So what do we understand by improving quality of life? It is enhancing overall well-being. Enhancing the overall well-being and providing comfort. And we do it by supporting the patient's autonomy, his right. We respect patient's values, patient's goal, and patient's preferences. What the patient wants when he or she is facing a serious illness. Whole person approach. So when any person who a day that person discovers and came to know that he or she is having a serious illness, for example cancer, the whole personality changes. The whole thought process, the view towards the life, towards their own self, towards his family, friends, everything changes, towards God. I would explain it in a way, suppose all of us here, if we are not having any life-threatening illness, suppose today we are told that you are having cancer, how your personality, the whole personality would change. How do you compare your today with your yesterday? What would be the difference? Yesterday we were living this life, and today, after knowing that we are having cancer, how our life would change? The whole personality would change. Our world would become upside down. Okay, whole person means our physical body who is having the disease would have some changes. We would have pain or other distressing symptoms. Then our mind, our emotions, everything would change. We may become anxious, we may become distressed, we may become depressed. So our mind, thinking, emotions would change. And also our spiritual being, our soul, would also have different views. You will start thinking about why this has happened to me, why God has done to me. Is it a punishment? Okay, whether I have done something wrong. You would start having physical distress, you would start having mental distress, emotional distress, even social distress, and then you would have spiritual distress. So the whole personality changes. In palliative care, in order to provide comfort care, we have to deal with all the aspects of your personality, whether it's physical, psychological, social, and spiritual. We cannot provide a palliative care or a comfort care just by giving some painkiller. We can't provide palliative care just by going and praying for that person. Okay? We just can't do it just by providing some social support. Everything is important, but we need to provide all of it, all four aspects of it. And to provide the holistic care for a person like this, we need a multidisciplinary team. One person alone cannot provide palliative care. We need a bigger team. We need different specialists. We need medical people, doctors, we need nurses, we need chaplains, we need social workers, we need family members, we need neighbors, alright, volunteers. We need support from each and everyone. Then only we will be able to provide a proper, good palliative care. So I hope you have got something about palliative care and you have got the right picture of it. Okay, palliative care started when somebody is diagnosed with a serious illness, not when he is about to die. Okay? Yeah. Thank you very much.
Palliative medicine is also rightly coined as the heart and spirit of medicine. And heart remind us of the love, the affection. So, rightly, palliative care is also known as morom shikisha, or we call it tender loving care. A foundation on palliative care, the Land Foundation from Singapore base, they published a book on the quality of death. And in that they specifically mention about the three quality of being a good dad is the availability of palliative care in the society. The availability, the number two, the availability of morphine. And the third is the social support from the churches, the NGO or wherever. So also when you Google the best place to die in, it comes based on these qualities, where people who are at the end of life, they are respected and loved. So here in India also started the flame from the south and now coming to even our Nagaland, and we are catching up. So I wanted to read some of the words about palliative care, mostly written by the patient about what the palliative care is. So palliative care is when they say you have no more care, or you have no more hope, or the hope is low. Palliative care is when I am in pain, afraid of dying, of pain, breathless, helpless, and when the hope is low. Palliative care says, we care, we will care, we'll be with you. Palliative care accept death. It's death accepting, but also life enhancing. Palliative care is patient centered rather than disease focused. Palliative care is partnership between the patient family, and the caregiver. Palliative care is healing rather than curing. It is comforting and caring. Palliative care says, you cannot die cured, but you can die healed. To die healed means being able to say or convey, I love you. Forgive me. I forgive you. Thank you. I'm going. Bye-bye. Palliative care is low technology but high touch. Palliative care is about aiding life to their days, not days to their life. And I want to read a verse from patient written about palliative care. Everyone was happy about my drawing. Everyone was happy about my dancing. I was happiest girl in my childhood. Everyone blessed me that I will have a bright future. Everyone appreciated my growth in my profession. I was the happiest lady in my adulthood. Everyone said that abnormal growth in my breast is the cancer. Everyone suggested I may go here and there for treatment. I was broken. Why is this punishment for me? Am I not going to see my daughter's marriage? Everyone suggested me to don't show my long hair. Everyone scared me that I will lose my hair like leaves falling off a tree. That because of drugs given for my uncontrolled growth on my breast, everyone was telling me cancer pain is unmanageable. I was intolerable in words and action of others. Everyone moved away from me because of bad odor. Everyone showing their faces because of the oozing from the ulcer. Everyone was busy with their business. I was the one bearing the excruciating pain from lymphedema. Lymphedema is a medical condition where the hand or the leg get swelling out of proportion due to the cancer or the illness they have in their body. No one suggested going to palliative care, but God showed me to them, oh my God, everyone in the palliative care team were incredible. Everyone's approach was remarkable. I slept that night after many years. Yes, because of the wonder drug morphine. I am relieved from excruciating pain. Yes, because of the white angel charcoal perfume dressing. I am relieved of the bad smell, the odor. Yes, because of impeccable dressing, I am relieved from the oozing wound. I am happy to move around confidently now. I am sure I got new energy that it would help me to see my daughter's marriage. Yes, because palliative care is a boon for me. This was written by a patient to a palliative care nurse in one of the AIMS hospital. Now I'll read a verse from 15-year-old cancer patient. It says about breaking the silence about what is happening and information sharing with the patient. Here I am, back again, these four walls closing on me. Though they were brightly animated colors which cannot erase the stench of these infectants, nor can superheroes save me from my fate. I was here 5 years ago, live here for 2. They poke me with needles endlessly, all the while looking at me with pity. And I lay watching the colorless drip into me. I was told to visit every year. I was always had a good report till one day I was told to stay on. I couldn't understand the harsh whispers or my parents retreating to a corner to weep silently. More doctors and nurses came to my bed. They said experiment was the only words I could make out. They conferred seriously among themselves, then would walk away shaking their heads. But no one cared to explain anything to a confused me. I'm beginning to feel worse and so tired. Gradually they stopped visiting me in their groups. Mother, the only one who keeps me company. Now I perceive that I shall never live here. I just wish those around me would break their conspiracy of silence. This was written by a 15-year-old boy, written to one doctor who was involved in Golden Butterfly Children's Palliative Care. It is about the boy has been having that problem, but he was curious about what is happening. But the parents and the treating doctors, they were not sharing the information. The struggle, the inner struggle that he is going through. That is why it is important to open and discuss which palliative care is about, good communication and creating a partnership with the patient. Recently, I come across a young boy who is in class 7 or 8. He was in the final stage of life, and then he was having pain, physical pain and spiritual pain, all this there. And then what I asked is, what do you want to do? Then he said, I wanted to meet my friend. That is the first thing. I wanted to meet my friend. And the rest, everything is explained. And with the team, the chaplain, we could able to talk to her, to him and family. And then he went home. He got a chance to say, express his wish and do the last thing that which he wished to. And then few days after, he came back, and then he was no more. He came back, he didn't express any other wish anymore. And then today he got admitted, the next day he died. So that is what palliative care is about. And my mentor told me, palliative care is 100% successful because all our patients die. But they are able to say, I love you, I forgive you, forgive me, thank you, goodbye, I'm going. And that is the measure of palliative care. And that is what we call quality of life and good meaning to the dying. So this is what palliative care is about. Thank you so much.
I take this wonderful privilege to be here and say something on this auspicious 28th celebration of the World Hospice Palliative Care on 11th October 2025. Every year, this palliative care is observed on the second Saturday of October. So this year, it happens to be on 11th October. And every year, we celebrate under different theme. And this year theme is Achieving the Promise, Universal Access to Palliative Care. Before I start my PowerPoint presentation, I would like to share how home-based palliative care started. Looking at the scenario of our Nagaland, as well as within the community, we see high prevalence of the chronic diseases like cancer, chronic kidney disease, heart disease, hypertension, stroke, diabetes, and frailty. Because if we really look into the community seems to be doing quite well, but then when we really look into each and every family, we all have such kind of a problem, and moreover, there is a lot of people time, but at the same time there are lots of aging population. And the problem with frailty comes. So looking into this, after my retirement, I thought I should do something. God has placed me with a good length of service. At the same time, after my retirement, He is keeping me so well. So I started to do something for the community. And my community where I stay is Ward 12. I thought I can do so many things, but then I am the only person, I cannot manage so much. So I stay in the Ward 12, so it has some few colonies. So I started this in Ward 12, and a charitable, compassionate community home-based care I've started under the name Serene Palliative Care, which was launched in 26th March of this year, 2025. So I'm so blessed and fortunate to have a good community. Ward 12 communities are very good. And especially today also, lots of them have come from Ward 12. Starting from each and every colony, the chairman, the colony chairman, they are so cooperative. At the same time, the council members, they are also willing to take initiative and support me with my endeavor. And at the same time, the church, they are so good. Like, they have the evangelistic team, so the evangelistic team, they are willingly helping me. What can we do? We have a list of patients. When we go to house for prayer, we have so many patients listed, so we are going to give you. So they give me with the list of the patients along with their problem, stroke patient, cancer patient, kidney patient, like that. So with that idea, I go in a day, I visit around 4 or 5 patients. I do by walking, sometimes I travel by auto. The disadvantage is I don't know how to drive. So maybe in near future, I can have a proper, better communication. But I take along with one of my nurses around here. She is also trained, Sister Cheng. She is trained in palliative care, luckily. And along with me, other evangelists, when we get free, 3 of us, we used to go house to house. And then it's not only the physical thing that we look into, but they are going through so many emotional problems and spiritual problems also. Okay, so this we are working on, and I'm very happy today also my community or colony chairman, the members, council members are here. If we look into the statistics and the studies in India, show a need for home-based palliative care, and it can vary from 1.5 to 43.1 per 1,000 population. So out of 1,000 people, so much of the people are in need of palliative care. It's it's so much. So it's highlighting the urgencies for the community-based home care services. Those patients and then the family facing chronic illness. So let me go to the inside of the palliative care. This is a very short slide. I will try to do it as early as possible in order to give time to our next. Okay. So, what is home-based palliative care? Because palliative care, it can be given in the hospital, the clinic, nursing home, as well as home, okay? So what is palliative care? Best care is means receiving expert medical and emotional support in comfort of one's home. Everyone wants, whenever someone is sick, we always want to be at home only. It focuses on making life more comfortable, dignified and peaceful for people with serious illness. Total pain. Now, my other speakers have talked something about total pain, and this concept has come from the founder of the palliative care and modern hospice, emphasizes the concept of total pain, which encompasses the physical, psychological, social and spiritual aspect of life. So when someone is sick, it's not only the physical sickness but also going through so many emotional, spiritual and social problems. Now if we look into the physical aspect, then we have the pain and physical discomfort, and then also we may have insomnia, fatigue, undesirable side effect of the illness or the treatment, and other many more. Psychosocial, if we look into psychological, then anxiety will be there, what is happening to me, everything will come to the mind, and fear of pain and death, loneliness, depression, anger, frustration, hopelessness and helplessness, grief and denial. The social aspect is the social stigma, isolation and abandonment, dependency, loss of role and loss of job, worry about finances and the future, other practical and legal issues. Now come to the spiritual. Whenever a person is sick, then you know why it's happening to me. Why it's only happening to me? I haven't done bad things, but why I'm going through so much of a pain, sickness and all that. There's a loss of meaning in finding purpose in one's life, demoralization and loss of one's identity, loss or challenges to one's faith, fear of the unknown, guilt and remorse, existential distress happens. And next comes why we need home-based care. Always home, nothing like home. Comfort, it gives comfort, relief from pain and symptom in a familiar environment. Affordable, cuts hospital and travel costs. Dignity, respects personal value, belief and choices. Family-centered, reduces caregiver burden. Support, taps into community and local support system. So these are in easy language. I don't need to explain. I'll just get to the next slide. Who can receive home-based palliative care? Anyone with serious illness, regardless of age or stage. Everyone thinks that palliative care is for the dying, and everyone thinks that palliative care is only for the cancer or for the adult, but it's not so. Palliative care is for all the group of ages and any type of chronic illness. Can be provided alongside curative treatments, especially helpful for people who prefer to stay at home. So like it doesn't mean that palliative care is for uncurable, but palliative care also goes side by side along with the curative treatment. Now next comes, who provides home-based palliative care? Today when I spoke with someone, they said, oh, today's program is only for your professions. But I've explained to him before also that it's a multidisciplinary team. Everyone is in palliative care. So now it's a multidisciplinary team. We have the doctors, nurses, the counselor, social worker, volunteers, physiotherapists, pharmacists also are there. One of my pharmacists is also here. So I'm so happy that he is also attending. So no one is left out. You know, palliative care is everyone's problem. We have to be, social workers are there, and then retired personals are there. People in other states, even the IS officer, retired IS officers, they are doing the volunteers job. You know, they will take the patient from their home and bring to the hospital and then get treatment and then take it back home. Or some big people working in the high profession and outside India, they come back and they do a lot of good volunteers jobs. So we all can do. As I've mentioned, palliative care team is surrounded, the patient is surrounded by the multidisciplinary team, the doctor, nurses, pharmacists, support workers, social worker, psychologists, physiotherapists, counselor, chaplain, volunteers, caregivers, family members. So these are the whole lot of the team. Now what does it include? So what palliative care does? It relieves the symptom. A disease may not be cured, but it can be, especially in a chronic patient, there's a pain, so much of a pain, breathlessness and other problems. I still remember when I was in the earlier days of my profession, I have assisted Dr. Tikon, R. Tikon in Zion Hospital. We have assisted with Bikitono and all, Dr. Bikitono, Oking Hospital. I've assisted them in doing a rectal operation of cancer of a young lady. Then after some time she was again admitted to the hospital, but the way, because of the pain, the way she was screaming, no one can be able to sleep. Like all the patients are disturbed. We never realized, and during those days, this pain relief medicine such as morphine was not there. It's a new thing that is coming. So, it's high time we realize to relieve the symptoms, give the quality of life, okay? A person may live for 90 years, but if a person is full of pain, with so much of a problem, there's no quality. But a person with 50 years with an incurable pain, then if he has the relief, and that relief will give him the quality of life, and he can still work his daily rituals. So that is palliative care, that gives the quality of life. So pain is also another important thing. Breathlessness and other symptoms will be there. Emotional support for the patients and families, guidance and training, because at home the family members are not educated towards this nursing care or whatever. So a palliative care team teaches the family members or any caregivers how to do Even bed making also, it's very difficult. There's a certain techniques how to do the bed making, or even to change the diaper. For an unskilled person, is so difficult to change the diaper. So there's a certain things how we can teach them, help them, and make all the caregiver patients at home, have a quality of life and with less stress and strain. Okay. So this guidance and training is very important. End of life care ensure dignity, comfort, and peace in final days. With a patient knowingly that he or she is going to doesn't have much more days, we are all scared of the word death. Okay? No one wants to see death. And we are also scared what the patient will think. Maybe he will think that we want him to die early. That concept is there. High time we need to change all this concept. From the palliative care continuum is from the beginning of the diagnosis till the course of the disease. It may be cured, it may not be cured, end of life, and also the bereavement period. Okay? So, end of life care is very important, not only to give the comfort, but the emotional, spiritual aspect has to be taken care of. Bereavement support help the families cope with the loss of loved ones. Well, I was in my service for more than 30 years. I haven't come across such in-depth and comprehensive care of a patient. But once I step into, after my retirement, once I step into this palliative care, I'm transformed so much. I myself is transformed so much. And definitely, the patient and then the caregiver also will be transformed. We were focusing only on the physical aspect of a human being in the sickness. But then now, the palliative care, the beauty, it's so applicable to all our Christian faith. It's so beautiful. So, during bereavement, not the person who is already died, he's no more. But the family members, the caregivers, they are into very deep, deep grieving. We should not neglect their grief. Grief is a normal process, but then there is a pathological grief. This is a mental problem. It comes into a mental problem. So, it's our duty to understand and help out people during their bereavement period also. So, in short, I just wanted to end my slide presentation. I hope I've made something clear about this home-based palliative care. And near future, I would really wanted to make again more, understand people. Today, I've invited so many people, we have invited so many people, but only few have come. But these are, your people, you all are so precious. You can do something for the community. And we all together can achieve something for the people who are really in need. And more so, in near future, we also will need this palliative care. Okay? We have to keep that in mind. So once we develop this palliative care in all the healthcare units, then things will be a better place for all of us to live. So I end this. Thank you so much.
First of all, I thank the Days Observance team making me a part of this auspicious occasion. Yet I'm hesitant to stand here to deliver this initiatives from the state government. I'm afraid if I don't do fair, because this department is just in the initial phase. infancy stage only in our government side. And then also recently I joined this national program for palliative care this year only. And when I have started surveying that one, I found only 6 districts being approved by the GOI in our state to open 6 units of national program for palliative care. So one is already functioning properly under the specialist of this Tegato, geriatric specialist. He is doing very well and serving the people so well there. The remaining to set up the infrastructure, it's left it to me, those are left to me, but I have just started whatever I could. Recently we have trained 37 MOs in our state, and there was intensive training we organized, and our in-service government doctors are not there, so we engaged our this geriatric palliative care experts here from Eden. Dr. Atiko is here, and our this Dr. Rontu is there. Even this Dr. Tony and Madam Obeng Jungla. So we had a real beautiful time. We found it that I wish I learned this palliative care earlier also. When we started the training, I wish I joined whole 3 days, but because of my busy schedule, I joined here and there. Whenever I joined, I really enjoyed it. It was so nice. Everyone learned so much, and they have realized, all the doctors realized that this is the core of medicine. The real physician should have this geriatric palliative care knowledge. That is what they have told me. The feedback was so good. And now, after the training, MOs will be doing again training to many nurses, because this is, as Madam and everyone says, it's a teamwork, and those to start the units as a palliative care unit also, the doctors need to have some knowledge to prescribe those restricted drugs like morphines and other fentanyl patches. So many restricted drugs will be using as a painkiller. They will be still doing some further practical exposures under those who are already functioning in that state. And nurses also will be needing very huge number in the state. Some got trained through our Palliative India. That is in charge is here, our friend Dr. Sangma. He is looking after that training. Palliative India is it's an online training. He has done a lot to our people, and still yet to do more. And this online training, even after learning, we need to do this physical training. So he was telling me this morning also that we'll be doing more to the nurses, MOs also, and on-site training also will be given for practical experiences and all. So we will be taking all those things because we learned that palliative care is a real nice, beautiful program which we really need in our state. We ourselves need it. Forget about others, we may need it. Every family has got these problems. When I realized that my aged parents, my father, he passed away last year, but my mother is still with me. My father was 103 years that time. My mother is now more than 100, and tackling all these things with so many aging problems, so many things that we needed somebody has to be with them all the time, because the pain is not the only thing. Even now, psychological management, psychosocial management, many things are there. This palliative units, if it were near our place, I wish they can really enjoy the treatment, the kind of medical attention, because these are real beautiful programs. So our state now, we are realizing, not only me, I've just joined as a program officer, but many of our friends now, they have realized that we have to take it up. So we are really looking forward, and we will be needing Open Jungla's guidance also and other expertise in our state. We are fortunate to have so good palliative managing experts with us. In today's palliative care definition, I have learned more today, but here Robert T. Cruz, his definition on this palliative care, I like the active total care of patients whose disease is not responsive to curative treatment. It is, when we think properly, the active total care of patients. So hospice or palliative care, this hospice is a part of palliative care, but palliative care is definitely much deeper and much more important phase of managing these aged people or seriously ill patients. So I really want to accept this one as a definition. Since palliative care is super specialty subject, having special mission on healthcare system and relevant to the modernized world that addresses the physical, emotional, social and spiritual needs and their families. The state government is putting its effort to make this beautiful program available to its community at the earliest. On behalf of our state initiative side, I wanted to assure you that during my stay, definitely I'll be doing my best to establish it. So far, we have just achieved some initial step, but long way to go. Our PIPs are not at all adequate. It was only one submitted and approved in a halfway only. So this coming years, we'll be putting up our PIPs to get more budget to set up the things full-fledged and properly also. And seeing today's theme, that this year 2025, achieving the promise, universal access to palliative care, let us all put our efforts to achieve this theme also. Thank you.
Actually, I'll just say you how I came to know palliative care a little bit. It was 2017-18. I had a beautiful auntie who I didn't know about palliative care. I joined palliative care in 2000. In 2019. So my auntie was very beautiful. It was in 2017-18. She was at our home. She was always full of very life. She had one son and she was full of life. She was always doing a lot of activities. She was very hardworking also. But then when she was in our place, slowly when she had cancer, she started losing her hair and a lot of things happened because of chemotherapy and all those things. And she started avoiding people. She stopped talking with people. She stopped talking with me also. She was very frustrated. I was thinking what was happening. I didn't know about palliative care. So then I joined Palliative in 2019. Now it is 6 years now that I've been in Palliative India. Now at least I know something about palliative care and what it can do. So now I understand probably the condition of my auntie who passed away, after a year of her having that cancer. So this is how actually it made me realize, when I joined Palliative India and I learned about palliative care, I understood that I could have done something. I could have, if I've known some palliative care center in my region, I'm in Guwahati or in other regions, probably I could have taken some kind of guidance or some kind of something from them to help my auntie. Unfortunately, I didn't know, and then I haven't heard about palliative care also. So it was like probably like ordinary person having a cancer, and then the person died, of pain and lot of personal losses, and our son was very small. So it really changed me, it really touched me. So I'm glad that I know many centers across so many places now, and I'm happy that I'm working with all the local experts like Dr. Atiko, Dr. Tony, ma'am is here, Father Chaco, and everyone. So I'm happy that I know them, and so that's how like I'm working here also in Nagaland, and so I wanted to talk about today about this World Hospice Day, and I want to present a little bit about what our organization is doing in very short. Okay, so our organization. Before I want to just share with you one more thing. I was asked before I came here. I think 1 week back I was asked actually by my organization, which are the states you want to focus. So you have mentioned 2 or 3 states. I told them the first one is Nagaland, the second one is Mizoram, the third one is Sikkim. So probably for some years I want to focus in these 3 states which are doing so good, and a lot of things are happening now. So about our organization, we are already 21 years old in the field of palliative care, and we have our founder who is also the founder and the Chairman Emeritus, Dr. M. R. Rajagopal. Sir have received a lot of awards, and the New York Times at that point of time, as calling the father of palliative care. His story was something like this. He had a neighbor actually, it was 35 or 40 years old back. He had a neighbor and he had a cancer, and he had tumors all over his face and scalp. And he was writhing in pain, he was shouting, screaming. And his mother doesn't know what to do about it. And sir was his neighbor. And he heard that sound. It was he could not ignore it because he was screaming and shouting at night. It was so painful. So he went to his house. So his mother asked him, our sir, Emerald sir, can you do something about it? Can you reduce his pain? Can you take care of him? Something like this. He said that I am just a medical student. I'm sorry, I cannot do it. He told like that. So he went back. So after some time, that person died, in extreme pain. So this was what changed our sir's life, and then he founded this organization called Palliative India in 2003. That's how it started. So we operate on this model we call as demonstration, education, and facilitation. We are also a WHO collaborating center, and we also provide consultant status. We also have a consultant status with the United Nations. We know all this, in Valley, a lot of people, because of medical expenses, they have to sell their houses, they have to sell their properties, and so many things because they have to get that kind of treatment for their son, for their father, for their dear ones, and believing that all will, everything will get healed. But in the process, so many people. They lost everything actually, especially in terms of not only physical or mental stress, but also financially they're just drained out. They have nothing left actually. We have seen some kind of people after losing everything, they are now they're on the road, sleeping on the road, eating on the roads. So that's what happens. And we always want to see our loved ones get healed and get well soon. Beautifully explained, everyone, Dr. Tony, Dr. Atiko, ma'am is here, and Dr. Kejo also about palliative care. You can have a look at the tree. That will really help, because that will give you some kind of, probably some kind of more idea about palliative care. In short, we call as like, holistic approach towards serious illness. This is what palliative care is all about. This is what we have been doing since we work on, on 3 models: demonstration, education, and facilitation. And I'm part of the facilitation department. So, like when it comes to the patients, direct patients beneficiary, we could reach out to, support them 28,000 to 44. Then we have family members. These are the indirect beneficiaries. So we have to reach out to this number. And yeah, so you can see the number for rehabs also. In education, definitely we could train a lot of doctors, nurses, allied healthcare professionals, non-medical persons. Lot of people we could train, and we're still trying to increase that numbers. We have some MOUs with some governments at the moment, and we are working with them. We are trying to get more MOUs with other states, but we call as letter of interest that we got. So we are working now with a letter of interest with Nagaland government in the northeast, with Sikkim also, and hopefully we can work with other states in the northeast too. So palliative care without community support or without community intervention, it doesn't work. It cannot be successful. They say that, our sir keeps on saying that community is the backbone for palliative care. Without the community involvement, it is very difficult. So what they can do and what they do, nutrition support they can give in terms of food, livelihood support, some kind of income generation, vocational trainings, education support. In regards to a lot of sometimes if the father or mother go through that serious illness, sometimes they have children, so they can be given some kind of scholarship, some kind of education assistance, so that life goes on. Assistive devices can be wheelchair, hospital beds, walkers, and all those things. Government schemes, there are schemes, we can do those kind of navigation, advocacy for the patient's family, to have access to those entitled social benefits and programs. And home modification, this is also possible to the communities, some kind of improvement access and adaptation, so that it improves care delivery. So this is the national presence that we have. I will not go in details on this. This is our vision to touch 10 million lives, Vision 2030, and this is only possible with all your supports. So we have been able to do works here in Nagaland because of all the support from all the organizations here locally. We have I remember that when I was first in 2019, I was invited, when I just joined Palliative, I was invited by Dr. Atiko to attend the World Hospice Day. It was in the referral hospital. That was my first, event for any palliative care, and I thoroughly enjoyed it. And it was a big exposure for me through Dr. Atiko. Definitely, my job in the Northeast is to have more and more partners for our organization, so that we have this palliative care center across in the Northeast everywhere. We had a beautiful directory in our website actually, where if you go to Nagaland, you can see all the palliative care center. The benefit of this is that, like, we have seen some patients, sometimes they go to Delhi, sometimes they're going to West Bengal or Chennai for treatment and all those things. And sometimes the doctor tells them that nothing can be done, please go back. And they don't know what to do sometimes. They come back and they get in touch with the doctor and all those things. So what happened when we raise a lot of advocacy and awareness, for the public, what happened, we understand that, they have a directory also in this organization. So they can click on that directory, Palliative directory, and they can see the center's name. And we have the doctors and the contact number as well. That helps, even though they might be in Delhi, they might be in Chennai, it will help them to at least get some kind of guidance, when they'll come back home. So we always look for partners, and that's my job in the Northeast. Right now, Northeast programs and West Bengal, this is where I'm working right now. So thank you. Nagaland has always been very close to me. I remember that I have come for a lot of events for World Hospice Day, and I'm so happy that that my focus on Nagaland, Mizoram, and Sikkim, it has also I got a lot of support from my head office also, and I look forward to more and more support from all of you. Community is very important, because we plan to also not the block office or district hospital, but also communities are very important. That is also we'll see how we can work closely. So I've taken a lot of time, I believe so. So anyway, thank you so much.
And I want to thank Father Chapo particularly for encouraging me or compelling me to be here today. And I really learned a lot, and I'm so enthused by all the speakers, and especially I give thanks to the collaborators, Syrian Palliative Care, Eden Medical Center, St. Joseph's Pain and Palliative Care Home, and Christian Institute of Health and Science. As far as I understand about palliative care, which has been rightly and well explained by Dr. Tony Vikas Vishwas and Dr. Atiko, and of course Dr. Obangjula, who may have retired from service but not retired from life. She is continuing, and we are so blessed to have such a person in our midst. And also Dr. Kezo, who has also been very forthcoming about how there is no limit to learning, no end to learning, and he's saying that he's still learning. It's a good thing. And also Nandu Sangma, who has also given us an overview about what he's trying to do, focus on Nagaland, Mizoram, Sikkim. Palliative care is something that I came to know only in 2023, was it, when St. Joseph's Institute, the palliative home was inaugurated. So I was wondering, what is this palliative care? Anyway, gradually I was informed that it is about caring about those who needed care. Of course, medically, clinically, a lot of people can get treatment, but as palliative care, the objective is, it's about caring beyond the clinical aspect, and that is very important. I personally experienced during the ailment of my late mother. She was 98 years and she was still going strong, but I think we as a family tried our best. We had compassion naturally. Our grandchildren and great-grandchildren all loved us so much, but compassion alone was insufficient. We had certain nurses also looking after almost 24 hours in a day. But I found that the majority of them were not having that sort of inclination for the compassionate sort of thing. They were very clinical. They have to go. They cannot wait. They must rush. I was thinking, like, if you really do care for the patient, you wait till your reliever comes. But they were in a hurry to go, and and sometimes. So palliative care is actually something that I think we need to encourage, because it's, like you said, holistic. and also takes care of the patient, makes the patient feel at least emotionally better, and that's very important. So in our state, we have a lot of our people are in need. According to the information that I got, about 5% or 6% of our people are senior citizens in our state. And according to the statistics that we got, in India they said that there are about 10 to 11% senior citizens, and that by 2050 they'll go to 20%, which is quite a big number. Leaving aside that, palliative care is not only about old people, it's all about everyone who is in need of care. And as we all have been discussing, these days nobody has time. Even if you love your parents, you don't have time. That's what I found out during the ailment of our mother. We all wanted to be there, but we didn't have the time. Everybody was busy. So we needed somebody to look after. But now if we can emphasize on palliative care in its true essence, that means compassion. I think that will be a very, because compassion to, there is no lack among us, but we need to have it skilled with knowledge of what to do. Just compassion alone may not help. We need to also train those, family or volunteers or whoever. And in my very simplistic thinking, I do feel that if we really want to promote palliative care, we can also, like some may have discussed, spread it out where we can introduce to schools and churches, maybe some sort of curriculum, optional. And particularly for village, I was thinking, because we all think only about urban areas, Dimapur or Kohima or Hospice, but we forget about the, the rural areas. So, state government is the source who can probably introduce some sort of basic training to the people there through schools, through the churches, and then if they finish the training, you can give them some certificates so that they can, if they are there in the villages, you can give them some sort of stipend, or if they want to go somewhere else, also you can provide some avenue. But I think that will be a good way if our state is to make some impact. And we really do need palliative care, because today, as we also know, our society is now becoming totally different, no longer what it used to be. It's very different. And it's in every society, especially when you grow old, you're loved less. It becomes a sort of a burden. So, we don't want to be a burden. That's why, if there is an army of people who are trained in palliative care, I think even the children will be more than happy to engage them. We can have a revolution, palliative care revolution. And I'm thankful to Dr. Father Chako. She's now qualified to be a doctor, expert, a non-qualified person, but qualified in experience. I've met him since those days. He was in charge of all this drug de-addiction, and he really has that compassion. So we are here And my only wish is, of course, we will also do our best, and I would also encourage the collaborators to also go through the media, to maybe print, maybe social, maybe whatever, to promote palliative care. Because it is not something that is avoidable, it's unavoidable, and we need that very, very, very much. And for Dr. Obangjunga, I think she should not get stuck only to ward number 12, because we have ward number 9 also very good. She should come to our ward. So I thank God for this opportunity, and I wish all the stakeholders the very best.